Hello everyone, today we are going to talk about acne. So, what is acne? Acne is a skin condition that occurs when your hair follicle becomes plugged with oil and dead skin cells. It is most common among teenagers, but it can happen to all people of all ages. So, where does acne appear? Well, acne may appear in 5 parts of our body. The first one is face, forehead, shoulder, chest, and upper back. There are many types of acne. So, let's go deeper in it. So, the first one is whitehead. Whitehead is a little white bump on the top of the skin. It is also known as closed plug pores. The second one is blackheads. Blackheads is an open plug pores because the head of the pore remains open. The third one is papules. Papules is a small red bumps that form when oil or excess skin cells block a pore and mix with bacteria on the skin. It is also known as pimple or zits. The fourth one is pustule. Pustule is formed when a blocked pore gets infected or caused by hormonal changes in the body. They are similar to papules, but it contains pus. The next one is nodules. Nodules is a large, solid, painful lumps under the skin. It is usually a result of the bacteria called Cutibacterium acne, causing a painful infection deep within pore. And the last one is cyst. Cystic acne is the most severe form of acne and is the result of an infection deep within the skin. Acne cysts are large, red, inflamed, painful, and pus-filled. So, have you wondered, can acne be popped? Well, it might feel good for someone to pop a pimple. But, according to Dr. Joshua Zechner, a dermatologist at Mount Sinai in New York, she stated that popping a pimple may cause infection and scarring. Therefore, it is not good to pop a pimple. This advice goes to the entire surface of the face and the other part of the body. But, there is one particular part of the face that should keep our hands off it. This part, also known as triangle of death. So, what is triangle of death? Triangle of death is the area of face connecting the nose to the corners of the mouth. It is a particularly dangerous area of the face because of their close connection to the brain. But why is it dangerous? This is because the infection in a pimple on the nose has a somewhat clear path to the brain. This is due to the presence of a large vein called cavernous sinus that drains blood to the brain, creating a connection from outside to inside. In other words, if someone pops a pimple in this area and infection develops, the infection may spread from the skin to the sinus, and thus has the potential to infect the brain and even spread to the bloodstream to the entire body. Therefore, we should bear in mind that we shouldn't pop any pimple within this area. So, here we suggest some products to help you in the treatment of acne problem.
The next medication for acne treatment is Nizodem ointment. Nizodem ointment is used to clear up acne pimples and blemishes. It also allows the skin to heal and prevent new pimples and blemishes from forming. The active ingredients found in Nizodem ointment are benzoic acid, salicylic acid, and precipitated sulfur. These ingredients have antiseptic, antifungal, and also parasiticidal properties, which helps to prevent acne. To use this ointment, we must first wash and clean our skin. Next, apply the product over the affected area every morning and night for 7 consecutive days. Then discontinue for 3 days and resume the medication for the next 7 days. This pattern of treatment should be repeated until the condition has improved and cleared up. For precautions, patients are advised to seek professional help if your skin does not heal or show signs of improvement after long term of use. Next, this ointment is meant for topical use only. Patients also need to take note to keep the product away from children. For storage and packaging, Nizodam ointment is packed in an airtight steel container and it should be stored at room temperature. Nizodam ointment expired 2 years after it was manufactured.
The next medication that can treat acne is erythromycin gel. Acne can sometimes caused by the growth of bacteria on skin. But don't worry, as erythromycin can help to treat acne because it has antibacterial property. It helps to fight and prevent bacterial infection on skin that can cause the skin to break out. It is also known as topical antibiotic that can help reduce the inflammatory acne for people that has acne skin problem. So how to use this erythromycin gel properly? Erythromycin is actually very simple to use, but before applying it on the skin, you should make sure that your hands are clean. This is not applied to erythromycin gel only, but to any kind of topical treatment. After your hands are clean, you can apply the gel thinly on skin 2 times a day in the morning and evening. Apply only a thin film of medicine lightly, using enough to cover the affected area. When you are applying the erythromycin gel, you have to make sure that it should not be focused on the pimple only. Instead, it should be applied on the whole area usually affected by acne. This will help to keep new pimples from breaking out. Avoid the eye area because erythromycin can cause irritation. If irritation occurs, quickly see medical practitioner for assistance. If moisturizer or any other skincare need to be applied after applying erythromycin gel, make sure that it is fully dried before applying other skincare, otherwise the product will not be too effective. Erythromycin should be applied on affected area for acne skin problem at least 2 months to see the effectiveness. There are many formulations to compound erythromycin depending on its indication, and it has a variety of concentrations. But the main active ingredient for erythromycin gel is always erythromycin itself. It acts as an antibacterial agent to fight acne growth. These are some of the precautions for the people who want to use erythromycin gel. Firstly, if another medicine is prescribed by doctor along with erythromycin, patient has to wait for 1 hour to apply next medicine in order to maximize the effectiveness. This may help to keep your skin from becoming too irritated. Also, if the medicines are used too close together, they may not work properly. Secondly, patients should know that when applying erythromycin gel, skin might sting or experience burning sensation that lasts up to a few minutes or more. This medicine may also cause the skin to become unusually dry even with normal use. If this occurs, check with your doctor. Next, use of cosmetic is not restricted when using this medicine, but it is best to use water-based cosmetics. You may continue to use cosmetics while you are using this medicine for acne. It is best not to use cosmetic too heavily or too often. They may make your acne worse. If you have any questions about this, you may check with your doctor. Next slide is about the storage, packaging, and expiry date. Erythromycin usually packed in a steel or plastic tube. This medication should be stored in a safe place to keep it far from reach of children. It can be placed, for example, at a high place so children can reach it. In addition, it should be stored in a cool and dry place. Erythromycin gel, if prepared extemporaneously, should be discarded after 1 month. If manufactured, the expiry date depends on the manufacturer and usually printed on the packaging, so it is important to always check the expiry date. That's all from me about erythromycin. Thank you.
The next one is Hiruscar gel. Hiruscar is a quick-absorbing, non-greasy, and film-free clear scar treatment gel that helps us to reduce scar visibility. Next, we go to the active ingredients that contained in the Hiruscar gel. The first one is allium cepa. Allium cepa is actually an onion, and the next one is allantoin. Allantoin helps our skin promote wound healing process by generally improving cell regeneration and helping to remove dead cells. It also improves the moisturizing effects. The next one is aloe vera. Aloe vera is well known for its healing properties, and it also helps to reduce inflammation from scalds and bumps. Next, we go to the mucopolysaccharide polysulfate. It is an unique ingredient to promote one healing process. And the last one is vitamin E. The indication or uses of the Hiruscar gels is divided into two types. The first one is for the children and the second one is for the adults. So for the children, it helps to appear softer, smoother and less visible from minor cuts, injuries and dark marks from the insect bites. It's also suitable for children that is over than 2 years old. So this is the example of the injuries and the minor cuts. So for the adults, it helps to improve skin flora with scar and to protect against scar formation resulting from daily accidents, burns, keloid scars. So this is the example of the keloid scars. The direction of use for the Hiruscar gels: apply gel on closed wounds twice a day or 3 times a day with the light pressure. For the precaution of the Hiruscar gels, it is used for the external use only. Do not apply on open wounds and discontinue use if irritation occurs. And for the storage and packaging, Hiruscar gel use collapsible cubes and it is along 12 months for the expiry date.
Now I will explain about benzoyl peroxide, benzoyl AC 5% gel. First is indication. It is a topical therapy for the treatment of acne vulgaris. Its active ingredient is benzoyl peroxide. Next is storage, packaging and shelf life. It must store between 15 to 30 degrees Celsius. Next, keep out of reach of children. Third packaging type is tube. It has 3 types of strength, which is 2.5%, 5% and 10%. It has a few opaque size, for example 15 gram, 30 gram and 60 gram. Its shelf life is 2 years. Next, we have instructions of use. We must apply or use 1 to 2 times daily or as directed to the affected areas. May initiate treatment with lower strength preparation. Instructions of use for patient. Always begin treatment with either 2.5% or 5% benzoic acid. First, wash the affected areas with a mild skin cleanser and wash and pat skin dry. Second, apply a thin film of benzoic acid to the affected areas once daily, leaving on the skin for 2 hours, then washing it off with water, then pat skin dry. Third, apply a light moisturizer which won't clog the pores. After 3 days, if no discomfort is felt, apply benzoic acid in the evening and leave it on all night. After 7 days, if there is no redness or peeling and your skin is not improving, apply benzoic acid twice a day, morning and night. Lastly, improvement in acne is usually seen after 3 weeks of use and maximum benefit after 8 to 12 weeks of use. Lastly, the precautions of benzoic acid gel. First, apply benzoic acid to the affected areas of skin that affected by acne. Second, avoid getting this medication into the eyes, inside of nose or mouth, or any areas of broken skin, since it may cause irritation. If this occurs, flush the area with plenty of water. Third, benzoyl peroxide may bleach hair or fabrics. Use carefully and avoid contact with hair, clothing and furnishing. Fourth, it will increase sensitivity to sunlight, and use of sunscreen is important. Skin peeling, redness, swelling or dryness, and mild burning sensations. It also will lead to allergies, contact dermatitis. That's all from me. Thank you.
Next, I'm going to explain about different cream, or the generic name is Adapalene cream. Different cream is used to treat acne vulgaris. Acne vulgaris is a common chronic skin disease involving blockage or inflammation of pilosebaceous units. Pilosebaceous units are hair follicles and their accompanying sebaceous gland. It is best suited for use on dry and fair skin. It is also appropriate treatment for acne of the face, chest, or back. So, how to use this cream? This cream should be applied once daily at bedtime for 12 weeks. Using the fingertips, apply a thin film of cream to the acne-affected areas. Ensure that affected areas are dry before applying. While applying this cream, avoid the eyes and lips. Next, active ingredients contained in this cream are Adapalene 0.1% weight over weight, methyl para-hydroxybenzoate, and propyl para-hydroxybenzoate. Different cream is packed in a collapsible aluminum tube coated internally with an epoxy phenolic resin and fitted with a white polypropylene screw cap. The shelf life of this cream is 3 years. Different cream should not be stored above 25 degrees Celsius, do not freeze, and keep out of reach of children. The precaution of different cream is pregnancy, women planning a pregnancy, hypersensitivity to the active substance or to any of the excipients, discontinue if irritation occurs, and should not be applied to the broken skin.
Next, I will talk about tretinoin cream USP 0.05%, which can only be prescribed by professional healthcare. I'm AINA binti Ahmad FANIZAL, and I'm going to brief you about this acne cream. First, the indication of this cream is it is a topical application for treatments of acne vulgaris. Next, this is active ingredients of this cream. First, we have stearic acid, isopropyl pyristate, polyoxyl 40 stearate, stearyl alcohol, xanthan gum, sorbic acid, butylated hydroxytoluene, and purified water. Instruction of use of this cream. We need to apply once a day, and it is preferably before bed. First, wash the skin with a mild soap or cleanser and warm water by using the tips of your fingers, and make sure the skin is completely dry. Next, squeeze about half an inch or less of the cream or gel onto your fingertips. Gently apply to the specific areas on your skin where you need it to work. Tips: using a larger amount of tretinoin won't make it work faster, because it could cause skin irritation. The packaging of this cream is in a tube, usually 15 to 45 grams based on its strength. For the expiry date of this cream, it can last for 1 year or more in airless pump. As for the storage of this cream, we need to keep out of the reach of children, keep at room temperature, away from heat, moisture and direct light, and do not freeze. As for the precautions, we need to avoid products that contain peeling agent such as salicylic acid and benzoyl peroxide. Last but not least, avoid products that contains spice, limes and alcohol, which also product that too drying.
Now, I'm going to tell you about Icon Tea Tree Oil Pimple Cream. This pimple cream contains 17 of active ingredients, which are water, butylene glycol, stearate 2, cyclodextrin, lactic acid, 0-cymon 5-ol, C12-215 alkyl benzoate, polyacrylate 13, 4-terpineol, which is tea tree leaf oil, PPG tree myristil ether, arginine, phytosphingosine, stearate 31, zinc lactate, octocrylene, Olea europea, which is olive oil unsaponifiables, and polyacrylate cross polymer 6. The indication is to protect skin from pimples naturally. This cream will penetrate deep into the skin. It is suitable for pimple-prone skin person and remove excess oil. Skin will be visibly clearer with a matte finishing. So, how are we going to use it? Let us check it out. First, you have to wash your face and pat dry it. And then apply small amount directly onto pimple affected areas or wherever your skin is prone to breaking out. Spread evenly and gently massage onto pimple until it completely absorbs. For best results, apply twice a day, once in the morning and once at night. This product is readily packed in 20 gram in collapsible metal tube. It should be kept in a cool and dry place. This cream is for external use only, and it should be used within a year after opened. However, it could survive for 2 to 3 years if sealed properly by the manufacturer.
Lastly, we move to the compare and contrast part. For the similarities, all of the products mentioned before are incapable of microorganism growth. They are also easy to apply and miscible with the skin secretion. Besides, they also have smooth texture and non-gritty. For the contrast, it may be different based on the type of semi-solid dosage form. Firstly is the texture. Ointment usually has greasy texture, while cream and gel have non-greasy texture. Secondly is the base. Gel is water-based and ointment is oily-based. Meanwhile, cream, it has two types, which is water-based cream and oil-based cream. For the appearance, gel usually will appear clear or translucent, while cream and ointment will appear translucent or opaque. And lastly is the uses. Gel usually used for oily skin or burns, while cream will be used for moderate dry skin. For the ointment, it will usually use for very dry skin and will act as protection barrier and give the occlusive effect to trap in moisture.